Hello, and how are you? My name is Winnie Barawa, and welcome to our session on concepts of school health. If you're new here, this is a YouTube channel that focuses on lectures, lessons, concepts, and even interviews pertaining to healthcare. And if this is your area of interest, feel free to click on the subscribe button so that you can be part of this channel, or also click on the notification button so that we can let you know when we post our next classes or lessons. Now, back to our today's topic on school health. This is one of the special population or special specialties among the healthcare areas, and it's being said that many people or very few people in the healthcare profession have joined this specialty. And if this is your area of interest, why not think around it so that you can specialize in school health and become one of the people who are very good or have expertise in running school health programs. So keep with me as we explore the different concepts that pertains to school health. So looking at the first concept is a school. So a school by word is an institution that has been designed for teaching students or whom we also call pupils under the direction of a teacher or a tutor. And more so, you need to understand that schools are also guided by documents that we call curriculums. And these curriculums is what will actually give the teachers the direction, designing them on what to teach, what to execute, and what to guide the students on. The second term is health. So, health by definition is a state of completeness in terms of physical, mental, social, and also spiritual well being, and not merely the absence of disease or infirmity. Looking at these two words is where we're getting this word school health, where we have the word school and then we have the word health. So, for school is the institution and the health is the state of completeness in all the aspects that we've mentioned: physical, mental, socially, spiritual, psychologically, and all that. Now, when you take these two words, school and health, is where you get the word
School
school
health, on
health.
the other side,
So,
is a
what is
state of
school health? Completeness in terms of physical, mental, social, and spiritual well being, and not the mere absence of disease or infirmity among pupils, teachers, and any other school personnel. This is as defined by Gilani, and this is bringing in the aspect of the school community. So when you bring in school health, you're simply combining or integrating health components into the school curriculum or into the school environment. So by definition, you'll talk about the completeness in terms of physical, mental, social, psychological, or spiritual wellness, and not the absence of disease or infirmity, but in a specific special population, and this is the school population. So we'll talk about among pupils, teachers, personnel, or any other person who is part of the school. So I hope that makes sense. Let's look into the next concept that contributes onto school health. Concept number 4, what you call the school health program, shortly written as SHP. So school health program, in other words, is an organized set of policies, procedures, and activities that are designed to protect and promote the health and well-being of the student and the staff. So when you talk about a program, we are talking about an organized set of either activities, policies, rules and regulations, procedures, and protocols that their main purpose is either to protect or to promote the health and well-being of the school community. So in this case, a school health program will have specific or various places of focus or various areas of focus based on the thematic areas that the school may want to look at that particular time. So you may find that in certain school health programs, some focus on ensuring health promotion, conservation, protection, and sometimes could be correction of abnormalities in the school population. We've had schools that focuses on special needs children. Now, in such a school, the focus might be promoting of rehabilitation and correction of these abnormalities. In other places of school, you may find the focus could be environmental conservation. In other places, could be animal protection and all that. So the focus of a school program can be actually guided by the needs of the school. It can be guided by policies. It could also just activities that the school wants to focus on. So these are all organized set of any procedures or activities that are actually aiming at protecting or promoting health and well-being of the staff or students. Okay, let's move on. Next term is what we call the school health services. So by school health services, we refer to any or refer to the need-based comprehensive services that could be rendered to pupils, teachers, or personnel. And the aim is to promote or protect their health, to prevent and even to control diseases and maintain their health. So any services that could be provided for while in the school environment then will be part of our school health services. And in a school, the services can be many. You can have immunization, you can have nutrition, you can have psychological and counseling services. There could be physical examination of children and can be treatment, could be nursing care, could be nutritional care. All these are possible services that can be provided in a school setting. And also in the school setting, most of these services are provided in the clinics, what you call them either the school sick bay or the school health centers, or you can have generally the school clinics. So the healthcare services in a school can vary, and as you can see, there could be immunizations, examination, nutrition, general screening, or medical checkups that could be done annually or in terms of terms or semesters. And the other concept is what we call school-based health education, normally written as SHE or SHE. So the school-based health education is actually a process, and the main agenda of promoting school-based health education is to encourage students so that they can be healthy and to do what they can, both either as individuals or as a collective activity to the school to help them maintain their health and to know when to seek help when they need it. We need to appreciate that in schools, children face different challenges, and these challenges, varying from bullying, varying from the fatigue of going to school, or the challenges of drug and substance abuse, peer pressure, adolescence, and so on. Now, when you provide the school-based health education, it's normally a comprehensive curriculum that looks at the need-based uh, requirements or the needs of the school, and then it gets guided by this curriculum to provide health education. So now the agenda of the health education is to actually encourage our students so that they can be healthy. It also to help us provide information or to ensure that students have informed decision and they have the correct knowledge when it comes to various aspects or needs in their schools. So for this purpose, school-based or the school-based health education is to allay or to provide health information to our school or to the students. And the main areas could be either physical, mental, social, and sometimes looking at emotional health. So all these aspects can be catered for in the curriculum that is catering for the health education at that particular time. And it can look into many things: illness prevention, self esteem, drug and substance abuse. All these are various challenges that students face in a school. And so, when you're developing a school based health education, it's advised that you check with the school the needs that they have at that particular time, and then you develop a curriculum that meets these particular needs, looking at if it is physical, mental, social, or also environmental issues. And then for this, then you can check, do you want to promote self-esteem? Do you want to promote illness prevention? Do you want to promote drug and substance abuse? Those are all possible places that the school-based health education can look into. And the other term is school health policy. So this is a common name that you need to understand because a policy means a document, and a document that is accepted mainly to promote health and well-being in school. A policy document, by definition, is any document in an institution that guides their practices or guides their day to day activities in the institution. And therefore, when a school develops a school health policy, it means it has developed a document that will guide the practices in a school with the aim of promoting health and well being among the teachers and the students or among the school community. Now, these health policy documents, they can be developed at different levels. You can have school health policies at national level. You can have school health policies at international level. You can have school health policies at local or in the institution levels. And for this purpose, there are different guiding policies. For example, at the national level, for instance, here in Kenya, we have the Kenya National School Health Policy. So this document was made to guide all the schools within the nation on how to conduct school health programs in their schools or to ensure that we meet the school health requirements for each and every institution or every school. But again, we have the WHO guidelines on school health services. This is an international policy, and what it does is it guides all the learning institutions across the world or worldwide on how to help them conduct the various school health activities in the institutions. So, like I said, the school health policy is simply a document that guides our practices pertaining to school health, and it can be developed either locally, nationally, or also internationally, such as in the case of WHO guidelines. And the other concept we need to understand is what we call FRESH. So, FRESH is an acronym that actually means focusing resources on effective school health. So, where did this word come from? So, this word was coined from a forum that happened in Dakar and that we call World Educational Forum. So in this forum, they coined this word to mean focusing resources on effective school health for the purpose of helping, educational institutions achieve effectiveness when it comes to school health programs. Because like we said, if you need schools to function properly, you need to have policies and guidelines that align and that are actually meeting the needs of the students. And for this purpose, FRESH was coined from this World Educational Forum to focus on four main components or to focus on four main areas that can promote school health or that can promote school health effectiveness. And in this, there was the first component of school-based nutrition, where there was need to look into nutrition needs of the students, like provision of meal packs, ensuring that the school budgets for meals for the students, development of school gardens, generally looking at the aspect of nutrition and diet so that students don't develop conditions like malnutrition. And we understand that with malnutrition, it can actually lead to low performance in school due to poor brain development. Then we have water, environment, and sanitation. This was to look into provision of safe water, providing of a safe school environment, and ensuring that there's cleanliness and hygiene in our learning institutions. The other part was looking into school health policies, and these are the documents that were to guide the different school health practices. And then there was school skill based services. So, with school skill based services, this was looking at different services that can be provided in our school in a bid to promote school health services. And so, you find these are the areas where school could introduce health clubs, school could introduce physical activities, campaigns and advocacy programs that could just enable the skills and knowledge of our students. All right, and then we have now the last aspect, and that is the health promoting school, shortly written as HPS. So, a health promoting school, by definition, we say this is a school that is constantly strengthening its capacity as a healthy setting for the living, learning, and the working of the students or the teachers. So, when a school is health promoting, we simply mean this school is constantly putting in effort or constantly strengthening its capacity in terms of setting a healthy environment that will promote the living, the learning, and the working of the students or even the teachers. And for this purpose, any school that puts the steps or puts the effort to ensure that it meets the learning needs of its students and it meets the working needs of its personnel, then that school is termed as a health promoting school or HPS. But generally, health promoting school just means the strengthening of capacity of the schools to meet the needs of its personnel or its community members. So in this case, this concept means it's it's surrounded or it is created on the foundations of health promotion, and this tells us that school health, one of its key component is health promotion. So how can we boost up our health promotion in schools? This is by looking at areas like resources, that is providing resources in our schools that helps us meet the needs of the students, providing or putting in place good school policies, providing good governance and leadership, a learner-friendly school curriculum, a school that is good in terms of socioeconomic environment, providing a good physical environment, and even providing good school health services. I mean, for the school to be healthy, then we need to ensure each and every component that builds upon our school is effective enough. And this can vary from the resources, it can go all the way to the policies, the government structures and leadership, the curriculum itself, and the social, emotional, and even the physical environment. So these are all possible areas that can be looked into, strengthened, and capacitated to promote a healthy school. And so if this is your area of interest, again, I say please remember to click on the subscribe button. You can comment on what it is on the content, share this work with your fellow students of health workers, and see you again in our next class.